Why is it important to focus on Medicaid reform on this anniversary?
Well, one of the things that Obamacare does to states is makes it impossible to cut Medicaid spending in two critical areas. We can't reduce the number of people on Medicaid, and we also cannot reduce the payments to doctors. So instead of limiting the damage from cuts that have to be made to the program to specific people or people who probably don't need the services as much, instead the state has to spread the cost over everybody who's on Medicaid, and Medicaid is already one of the worst programs despite how expensive it is. So we provide poor care, expensive care, and Obamacare just makes it even worse.
There are certain types of changes and reforms that you do suggest can be made.
Yeah, there is still room under Obamacare to make some changes in long-term care policy for people who are elderly or disabled and need the chronic care services instead of going to see a doctor now and then or going to the hospital now and then. For those people who need nursing home stays or other types of care, there's still room to cut there. There's opportunity to remove some of the optional services that Medicaid covers. We list some of those in our alternative budget. And then the other thing that states like Rhode Island have already led in is changing the entire way that you run the Medicaid program, getting a block grant from the federal government so that you have less incentive to expand coverage and actually are able to focus on what Medicaid can do and should do and actually provide services to people instead of promising things that you can't pay for.